You're watching the Wellness Hour Live. I'm Randy Alvarez. Double mastectomy, a lot has been talked about in the news lately. And is it for you? With us, we have an interventional radiologist, oncologist, Dr. Jeanne Stryker. Dr. Stryker, welcome to the program.
Hi, Randy.
So women have been diagnosed with breast cancer, and now for prevention, they're getting double mastectomies. So we'll jump right into it. What are your thoughts?
Well, when you say prevention, are you talking about they've been
trying to
tested
prevent
with
a future?
Yeah, I think it's a little bit hysterical. When you look at Europe and you look at here, there's a little bit of hysteria with it, and I think some of it is because we worship the celebrities, and I think you really need to look at the facts of family history, your genetics. Do you have the BRCA gene? Because if you have the BRCA1 or BRCA2 gene, then your risk of developing breast cancer is much more significant over your lifetime than somebody who has either a family history or, I mean, I have to say, when I diagnosed women with breast cancer, there was no family history. So you have to really look at the genomics. But with the BRCA1 and the BRCA2 gene, their risk of, they are going to get breast cancer.
Do women with breast cancer, do they know these terms? Like, I don't know these terms. Do they know that?
They do.
Okay.
They do. It's been on the news enough that people know about the BRCA gene now. And there's certain heritages that have a higher risk, but we know with the BRCA gene, it's not a matter of if, it's a matter of when. And so I think it's a personal choice. I know that if I had the BRCA gene, I've had my kids, I've nursed my children, I would just go ahead and have the bilateral mastectomy and have.
But if you don't have this BRCA gene?
If I don't have the BRCA gene, then I think really it has to do with genomic medicine and wise lifestyle choices.
Okay, so are there people without this BRCA gene? Is that rare, by the way, to not have this gene? By any chance?
Is it rare?
Yeah.
No.
Okay, so if are you implying that maybe there are people that are getting double mastectomies that don't need them? That it doesn't decrease their chances of the cancer revisiting?
Well, there's always a risk of the cancer revisiting because you can have chest wall invasion. So you can remove the breast tissue, but cancer is really sneaky. So if you have a cancer there and it's already within the skin and you don't know that because there's micrometastasis, then there's always a risk that it can come back with chest wall invasion.
So is it just a personal choice?
It's a personal choice.
Because I mean, most of the women getting breast cancer, a lot of them have children. I have children. So if I thought that there was a way where I was going to have a better chance to see my kids grow up, et cetera, and not put my kids through that, I would probably personally, if I knew for a fact and statistically, if it's better off for a double mastectomy, then why not?
Yeah, I mean, I think it's a personal choice, but I do think that it.
What do you think, though? I want to know your thoughts.
I think that it's we're going a little bit overboard. We're being a little bit emotional about it because I'm coming from a perspective where my mother was diagnosed with breast cancer, and she's the only person in the family. I did my genomic testing. I know what I need to do to assist my liver in detoxifying. I'm missing certain, I'm missing the glutathione gene, and so I know I take those supplements every day. And balancing hormones. If you've got too much estrogen in the body, you need to have certain ways, eating certain foods, certain supplements will help you get rid of that excess estrogen. Alcohol increases your risk. But then there's a downside. If you exercise a lot, then you're reducing your risk if there's alcohol involvement. So we know obesity, insulin resistance, all of that increases your risk of breast cancer.
But if you've had breast cancer, aren't these people especially afraid to do hormone therapy?
Yes, they are. They are afraid of hormone therapy.
Okay. So your opinion then is to speak to what? Like an integrative medicine doctor? Speak to an interventional radiologist before making the decision to get a mastectomy? I mean, who should you talk to?
I think you should get as many opinions as possible.
But who? Like who?
So a surgical oncologist would be a good person to talk to, an oncologist, and you want to know the statistics. You want to know if this was you, and this is a very important question to ask. If you were the oncologist, what would you do? Because they know what's happening with their patients. And then I really believe in integrative medicine. And so those are medical doctors that are practicing ancient medicine with modern medicine. And we have really advanced in the terms of targeted therapy, vaccine therapy, genomic medicine, So if you do the genomic tests and you know what your risk is of eventually developing something and you're missing that enzyme, then you can take that particular supplement or targeted therapy
Okay.
and bypass.
So
that
for
step.
prevention, we're out of time. We literally have about a minute. Is there a woman feels good, right? She hasn't been diagnosed with breast cancer. What testing can she get to let her know if she is, somebody that has at high risk?
I would do hormone therapy. I would measure my hormones. I would look at the estrogen pathways and how you're breaking down your estrogen in your body. I would do the genomic medicine, and I personally believe in ultrasound and MRI as a form of prevention screening.
And okay, so mammography after 40?
The law says I'm supposed to say that that's the gold standard, but
Okay, so let's say that's the gold standard. What else can they do? What other type of imaging?
they can do 3D ultrasound,
Okay.
and they can do MRI.
All right. Now, what about that other type of?
Oh, thermography?
Thermography.
Thermography is looking at inflammation. It's looking at heat patterns. It's not so specific, but it's very sensitive.
But when I hear people saying, Randy, because I don't know who to believe sometimes, right? That thermography can spot a cancer cell 10 years before it would ever show up on a mammogram.
Well, you're seeing inflammation and you're looking at heat patterns.
So is that not true, that statement that I just made? When somebody tells me that?
It's a risk. It's showing you a risk. So over time, if that heat is increasing over time, then it's you have a 22 times greater risk of developing
3D
cancer.
ultrasound, a CT.
No,
I'm sorry.
MRI.
MRI, 3D ultrasound, and maybe this thermography.
Yes.
Maybe or yes, thermography. And how often?
Once a year.
Once a year. And of course, get your mammogram. Okay, well, good. I want to thank you for coming on the show.
Thank you.
Always a pleasure, Dr. Stryker. You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.